Hi, and this is Julie with Wonderfully Made Mastectomy Care and Intimate Apparel, and I hate making videos. Doesn't everybody? Some people love it, I guess, but I hate making them, and I just made a whole video about post-surgical stuff for y'all, and my head was chopped off. So I had to regroup and move, and I just got comfy in the chair in my room to go over some of this, so I have the computer a little bit more set up efficiently and just kind of regrouped. So let me try to see if I can cover some of the things that we talked about a while ago, or that I talked about a while ago, and we're gonna see if we can get some of these videos out to y'all. I wish I could just make myself an avatar, but all of the information is up here and I need to get it out there to y'all. So anyway, let's talk about post-surgery bras and what that looks like. So if I'm looking over to the left, I'm looking at some of my notes and some of the questions that y'all have raised either on platforms such as mastectomy groups and that sort of thing. The first question is, how do I know that the bra fits correctly? That's actually the wrong section. See, here I go. Post-surgery. Let's go to post-surgery. Okay, post-surgery. So what is going to happen post-surgery? So I recommend a post-surgical bra. I recommend that if you are doing bilateral, that probably should have some form of compression to it. One of my favorite post-surgery bras is a Resilience bra by a company called 3 Strands. And you can get those on our website, wmmcare.com, I believe. And if not, we'll make sure that you can, or you can call the store. But, so this bra is actually put on people in ORs around the country in cancer centers because it does a couple of things. Most post-surgery bras actually do have some form of drain management when you come out of surgery on your mastectomy side or on your explant side, if you've had implants and you're explanting, or if you've had deflap reconstruction, you are going to have drains. And we'll cover that more later in a different video, hopefully, but most post-surgery bras do have some form of drain management. So this bra has good drain management, but what it also has is that if you are unilateral, it can accommodate a really large breast tissue on your opposite side. Not all post-surgical bras do that. Most of my mastectomy companies go up finally into like a G range or an H range even. But those we can go up a little bit higher. So it has great cup projection, and we can get you fit in those in a cup. But the biggest issue about that bra is that it has an adjustable band to it that Velcros in. The Velcro is really good, and the band has almost like a fitted belt that comes around it, and so you can leave it really loose when you initially have surgery, and you can then tighten that up. And unlike some other brands that will remain unnamed on this video, the Velcro actually works really well. The drain management unsnaps from the bra after you no longer have drains, and you can wear that bra for 6 to 8 weeks, and it's got great support. It has mild compression, and we can put prosthesis such as a post-surgical puff is what I call those. It also comes with some built-in pads that actually come with the bra as well, and overall it's a great bra post-surgery. 6 to 8 weeks, that's the one that we recommend. There are always other post-surgical bras. So it really depends on your circumstances and what you're having done, and most importantly, what your physician wants you in. That is the key here, is that we are here to accommodate your physician and your needs to make you comfortable all through that healing process. So when can you start wearing a quote-unquote regular bra again? You can start wearing those usually 6 to 8 weeks. Post-surgery is going to be the quote-unquote regular bra and a silicone prosthetic. You can now handle the weight of that prosthetic in there. We do use a lot of lightweight prosthetics, and we, like to keep you comfortable. But at that point, you can handle a silicone prosthesis, and we want all of your scars healed and all of the scabbing to be gone, and all of that excess adhesive that normally is around that incision site. Hopefully that is, washed away in your regular hygiene. That's gone. And so we don't want any infection, any real redness, any fever in that area. We want to know that you are comfortable and that you are ready to move on with regular mastectomy bras and regular prosthetics, because those mastectomy bras do give you some support underneath the arm, on the side, in the extra tissue that sometimes is left at the end of that incision out there under the arm. And so they give you that support. You have the mastectomy pocket to wear the prosthetic. And the goal is from surgery day all the way through until 2 months and 3 months and beyond that you are comfortable and that you look like you feel the most normal that you can, especially in your clothes. When you get dressed in the morning, you can walk out and head into a department store or a follow-up physician appointment or anywhere, and nobody really knows why you're there. They don't know that you've had a mastectomy. And that's how you should look, and that's how confident you really should feel in your clothing. So that is our goal at Wonderfully Made, and that is just a little bit about the post-surgical process. We also recommend, if your hospital does not do that, that you find some form of an underarm pillow. We actually gift those to our patients at Wonderfully Made, or we attempt to. We normally have them, as well as the local hospital here. A lot of these local hospitals have items such as these underarm pillows that volunteers have made with love. Some of them have been prayed over for your cancer journey. And so we want you to be comfortable at home, sitting in a chair much like this. You get home and you start to recover and you're kicking back in your comfy chair, and you need something to kind of cushion under that arm and up next to that surgery site where your arm doesn't rub or press too far into it. And so if you can find you a good post-surgical pillow, those are always helpful. Also, drain management for showering. We have some options for that at Wonderfully Made. And those come in the form of lanyards. Some are like a key lanyard that goes around your neck. And you can, those are made out of neoprene for the shower. And then it is a mesh bag that holds those drain bulbs for you to shower. There's also a great elastic band type one that we have also used. We've used that in our family for drain management. And it just Velcros those drains right in while you're in the shower, and then dries off nicely in the next hour or two. You just hang it to dry on a hook or somewhere, and it dries out for you and ready for you to use the next time you get in to shower. So there's options there as well for post-surgical. And if you will just give us a call or take a look on our website, those items can be made available to you. They are not always covered under insurance, or I'm not sure how we would file those. I'm not saying that you can't do it. You can. But we take care of the post-surgical bra, and we do file those on insurance. So if you will call us, we will be happy to set you up with that, along with post-surgical puffs, especially if you're unilateral. I call them a post-surgical puff. It's like a little pillow. It's a little bit, I'm not going to say a little bit better. Knitted knockers have been around for a long time. If you're not familiar with those, look them up. They're made by volunteers, and they are great. But the post-surgical puff, if I can speak, is a little softer, and so it just helps in that process when you're wearing that in your post-surgical bra to give you a little bit more comfort against your chest wall and for your recovery. But the knockers are also wonderful in areas that you can't sometimes get post-surgical supplies. So this is Julie. I'm Julie with Wonderfully Made, and visit us on our website. Like us, follow us on social media, and subscribe if you happen to see this on YouTube. And we really thank you for that. I hope you have a wonderful day. Thanks. Bye.